Good afternoon, everyone. Good morning, depending where you're joining us from. We are now gathering for the last concluding session of this third Digital Health Society Summit. I think it's with those events, it's the same like with Christmas or other holidays. You're preparing for that, you're looking forward, you're excited, then you enjoy them, but then they pass too quickly. And then before you realize it's over and it's the final session. So I'm here with Bleddyn and Rees, the Digital Health Society chair, to conclude on those 2 days. As the host of today, of the day 2, I will give a short wrap up of this day, and then I will pass to Bleddyn to the closure of the whole event. So what happened today? Well, we had a long day with 4 sessions, 5 exciting fireside chats. During the breaks, you were able to visit the 23 virtual booths. And we're actually ending this event with almost 800 registrations from more than 60 countries. So we can definitely say, and it's a bit something that is repeated all over again, that this pandemic is despite the fact that it's a huge challenge, it's also an opportunity. And of course, it's been an opportunity for us to gather more digital health professionals, experts, enthusiasts, and members of the wider digital health community than ever before. When the Digital Health Society Summit started 2 years ago during the Finnish EU presidency as the on-site event in Helsinki, it had some more than 200 participants, and today we were more than 780. So that's definitely a plus side, and let's look at this bright side when we are thinking that, well, we cannot meet in person. Our community is stronger than ever, and this was also highlighted in all the talks, all the speeches that we heard today. So just as a reminder, the topic of today was connecting the dots between innovation, knowledge, and community. And as I said, we did it with the 4 sessions and 5 fireside chats. During the 2 of those sessions, you were able to get to know better 7 of ECHAlliance 10 active international projects. So we we brought to you the knowledge, experience, and innovations developed within those 7 international initiatives. We also brought together 5 ecosystems from different countries, and we had a fantastic crash course on the ecosystems and the thematic innovation ecosystems provided by Andy and Bleddyn. And then maybe summing up or concluding on some topics that came, or some themes that emerged during today. So, of course, the theme of the summit is the data for society. So, of course, all the discussions somehow focused on exploring this further. And I listed here 4 themes, something that I heard like really coming up all over again. So maybe starting from the key theme, data. So of course we heard, and I think this is a truism, but as someone posted on LinkedIn yesterday, it's true, and it's a truth, but it's true that of course the data is a key resource and base for all our development, and we really need to make sure that health professionals understand it, that the people understand it, society understand it, and also that we have the conditions to collect good quality data and to make sure that this data is utilized not only for treatment, not only for diagnostics, but also for the predictive analysis, so that actually the value of that we can embrace all the opportunities coming together with this data. Another topic, another theme was, well, we heard a lot about the user's perspective, that the developers of the digital solutions need to really understand users' perspective, and not only the needs but also the daily context. What is the daily context when the solution is being used, and the values of the people? Because only this way we can create the sustainable, meaningful digital solutions that actually bring the change, bring the value. Then moving on on the skills, of course, we touch on this. We cannot not speak about the skills. So we spoke about skilling, upskilling, and we had great examples also of the real solutions brought to make sure that the society, the healthcare workers, other workers can update or upgrade their skills with the different digital academies. Some solutions that actually bring the change, because we also heard that, well, the pandemic, of course, elevated the digital health, made us aware that we need the digital health solutions. Those solutions were deployed, but then so what if older people or some groups of the society were not able to use them? And here I think we relate very well to the discussion from yesterday, that we need to do everything to avoid the digital hesitancy, that we don't really lose those people, that we don't have the digital dropout. So this is one of the element. And still on the skills, that, well, to develop the skills, we really need to explore not only the health sectors, but the different domains of the economy, and health is the crucial sector, but we cannot forget also about the other domains of the economy. And then ecosystems as a topic of the presentations, but also ecosystems generally as one way of working. So we heard the call for ecosystem-based collaboration, because, as Bleddyn actually said, no one has a monopoly on innovation and good ideas, and we need to connect the people to make those, to brainstorm together, to make those ideas better, to learn from each other, to extend their markets. Like we heard, some countries are a really small market, and for the companies, they need to grow. But I think also one thing that will stay with me is that we need to connect policy level with the company level. And it was also great to hear that the Digital Health Society is a platform for that. We also heard that we are more collaborative than ever, and I think that our 70 or more than 70 ecosystems and emerging constantly new thematic innovation ecosystems show that there is the need and there is the will to connect, to collaborate together. So there is definitely value in exchange. So we don't compete, we collaborate, and this is actually the message that the whole ECHAlliance and the Digital Health Society wants to bring. So I think that with this I will end. The first fireside chat said that the pandemic has been a renaissance of the public health, and again I would like to come back to this notion that well, pandemic has been kind of an opportunity for all of us, and the opportunity for the digital health to grow. But there is, of course, a lot of work to be done to make sure that those solutions are meaningful, sustainable, user-friendly, policy-friendly, and financially viable. And for that, those ecosystems that we develop and we facilitate, we boost, and you all actually boost, are one way for this collaboration to grow. So thank you so much for this day. I think there is a lot thinking about a couple of hours of discussion. And yeah, I would like to pass now to Bleddyn and Rees to wrap up the summit. Thank you.
Karolina, thank you. And I'm going to just be very quick. So 4 quick announcements to start. So the ATA have the EDGE Policy Conference in Washington between the 6th and 9th of December this year. It'll be in person, although it'll be on demand after the event. Secondly, the second Europe Africa Health Summit, Skills for Health, Skilling Up the Workforce, 19th of January 2022. It's virtual with the Africa Health Federation. Thirdly, the Digital Health and Wellness Summit, which the ECHAlliance runs, is in Barcelona at Mobile World Congress 4 years from now, the week commencing the 28th of February to the 3rd of March. We're not exactly sure which date. And then the fourth quick announcement is that we will be launching an AI club, which Rachel Dunscombe will lead. So watch out in our newsletters and press over the coming couple of months for details of what that involves. But if you have an expertise in AI, by all means, contact Andy and let us know. And then just a couple of quick thank yous. So first of all, to our partners. So I'd like to thank again J&J, Microsoft, Africa Healthcare Federation, ATA, Health, the Commonwealth Digital Connected Health Health Parliament, ORCA, IHD, and the Vodafone Center for Health with Deloitte. And then finally, to thank all of you as the attendees for giving up your time and making our conference a success. To all of our speakers, and there were about 46 of them, and I thought they were really fantastic, and we are very grateful to them. And then finally, to the wider ECHAlliance team, without whom none of this would have been possible, and for Karolina and I, our colleagues who've helped speak at the events. So I wish you all a good evening and a good Christmas and a Happy New Year. And we'll see you in 2022. Thank you very, very much.